Hi, I am Dr. Jethwa. I am from Anand, Gujarat, a milk city of India. Today I am going to discuss with you a few things about the LASIK surgery. LASIK surgery is done for removal of spectacle glasses and to have a vision without glasses. LASIK means it is laser in situ keratomaleusis. So this is medical terminology, but in short we can say that it is a treatment to correct the glasses with the help of a laser rays. Here a ultraviolet low frequency lasers are used, which makes the shaping of the cornea in such a way that it can focus the image very clearly and sharply over the retina. Now let us discuss who are the fit for this LASIK surgery. As you know that all the patients are not fit for this surgery. There are some particular protocols, some principles we have to follow before we advise patient for a LASIK surgery. First of all, the patient's age must be more than 20 in females, and in males it should be more than 22. Why we have such limitations of age? The reason is our growth of the eyeball and the length and shape of the eyeball is usually changing till the age of 22. Now once this age is achieved, we can have a very good shape and fixed dimensions of the eyeball, and in short, after this age, chances of changing of the glasses, means it increasing or decreasing, are very less. In short, it is a stabilized power of glasses. Once the glass power is stabilized, we can advise the patient for a surgery. Suppose the patient is willing to go for a LASIK surgery at a age of 15, then if we correct the glasses at the age of 15, but if there are by chances it increasing power, then patient may get a residual power or high power during the age of 20 or 22. So whatever changes are occurring in another 5 years, patient has to wear the glasses. So this is the reason why we don't advise LASIK surgery before the age of 20 or 22. Second thing is, we have to check for a hormonal therapy if some lady patients are taking, or history of pregnancy or lactations. So this should be avoided before advising the LASIK surgery. Or about the history, we have to check the eye for its pachymetry, that is the thickness of the cornea, condition of the cornea, which is there is a dryness or that or not. Secondly, some corneal opacity or injury of the cornea, or some past history of surgery. This should be taken in consideration before advising the LASIK surgery. Particular thickness of cornea is minimum, because we have to shape the cornea, and by shaping we need some thickness of the cornea, and of course it is very minimal loss of the thickness. It is average is 60 to 70 micron of the tissue loss is there, but still we have to keep some minimum thickness of the cornea, which maintains the shape and normal curvature of the cornea. Now if the patient has a corneal thickness less than 490 or 480, patients are not suitable for LASIK surgery. Secondly, if suppose the patient has a very thick cornea, 520 or 540, but patient has a very high power, suppose -9 or -8, these patients are not suitable for the LASIK surgery, because the more the number requires more ablation depth, and there are more chances of a thin postoperative corneal we can say thickness. Second test is done for the corneal health. We have to check whether the dry cornea or normal corneal wetting is there or not. Third test is topography, that is the shaping of the cornea, whether topography means the up and down shape of the cornea, which is to be studied very well, that whether the cornea is within the normal shape or it is out of the normal shape, then we have to advise accordingly. We have to exclude few diseases like keratoconus. It is a condition in which instead of a dome-shaped cornea, it becomes a cone-shaped, and this cone-shaped cornea makes a cornea very thin and irregular in shape, and in these conditions LASIK should not be advised. Fourth thing is some advanced tests are also necessary like pentacam, where we can know the posterior surface of corneal conditions, not only the anterior, and we can give more detailed, very exhaustive softwares are used to find out normal health of the cornea. Or and above these tests, a test for retina is also necessary, because retinal conditions should be evaluated. Retinal holes or retinal breaks should be treated before the surgery of a LASIK. Thirdly, in elderly patients, a cataract should also be ruled out, because patient may have glasses due to the cataract, and in these conditions LASIK is not advised. If the corneal conditions and preoperative workup is done very well, secondly, if the power of the glasses are within the limits, then we can give a patient a very good vision 6/6 or 6/9 without glasses, and it happens to almost all the patients. So many times the patients ask about recurrence of the glasses. That's called a regression. Regression can happen in some patients after a few years, but it is not more than 10% of the original power, and it happens in a very few patients, 1 or 2 out of the 50 patients, and which can be corrected by reapplication of the laser, and it is not more than 10 to 15 seconds. So secondary surgery is possible in a patient who has a some power which is residual power is there or regression is there. Thank you for your kind attention.